Hi everyone, I'm Robin Lopez. I'm one of the clinical educators here at CMC. Thank you for watching this video. I want to introduce all of you about a new procedure and new products that we have in place for small volume medication administration. Small volume medications are defined as any medication volume that's 200 mLs or less. We will have these wonderful guides for you in your medication rooms that list all of the small volume medications that we administer in-house. This procedure applies specifically for when you are administering small volume medications to a patient that does not have a primary fluid running that you can piggyback into or is not compatible with their primary fluid that's running. When you do need to administer a small volume medication that you cannot piggyback into a fluid, you will need 2 sets of tubing for the Alaris pump. The first set of tubing is going to be your BD Alaris 3 SmartSight Y set. So this has 3 Y-site connections, which I will show you when we have this set up. And then the other one you're going to need is your BD Alaris pump tubing. This is a short tubing. Again, I'll show you that a little closer once we get this set up. And then of course you'll need your medication, and you will also need a carrier fluid. The carrier fluid is going to be what flushes the medication into your patient, and it needs to be compatible with the medication that you're infusing. Now that you have verified your order and determined that you need to administer your small volume medication using the small volume medication set, you've gotten your carrier fluid that is compatible with your medication, you've activated that order in Sunrise, you're going to set up your set in the Alaris pump. Make sure both of your channels are next to each other on the pump. This allows the short set to connect into the primary set, the middle port, which is right underneath the channel, as you can see here. What you'll also see here is that the carrier fluid, which is going to flush the medication through the patient, is connected to the long 3-port primary set. Your medication is connected to your short set. What this allows is for the majority of the medication to be delivered to the patient. There's only about 1 ml left behind of medication when we're using this small volume medication administration set. So once you get that connected and you get it connected to the patient, then you're going to go ahead and program your pump. So once you have your tubings primed and everything's connected in the pump, you can go ahead and program the pump to administer the medication as you would with your normal primary set. Make sure you're selecting the correct channel that the medication is connected to. Program it to run as it's ordered. Once the medication finishes, it will end right below the air in line sensor on the pump. And then once that alerts that it's complete, you would come in and you're going to flush the rest of the medication through to the patient. In order to flush the medication, what you're going to do is you're going to select the channel that is connected to the carrier fluid, and you're going to choose the appropriate solution, whether it's normal saline or D5, and you're going to select that channel and you're going to administer 15 mLs at the same rate that the medication was administered in. This will ensure that the full dose is administered to the patient. This is an intermittent infusion tubing set, so it'll be good for 24 hours, just like your other intermittent tubings. Make sure that you label them so you can use them for the 24 hours. And of course, the carrier fluid bag is also good for 24 hours, as long as everything's labeled appropriately. Please be aware there are some special considerations for Zosyn or piperacillin tazobactam. Make sure you look at the PowerPoint to see what those special considerations are.